going to try to look up some interesting articles today uh, in psychiatry, kind of about new adult treatments for different conditions. And let's kind of look at new adult ADHD treatment. ADHD, what's more fun than that? Big debate over whether or not it's real, it's not real. I think it's real. I don't think it's a disease, but I think it's real. Um, and I certainly have opinions about whether or not it's important to treat. But let's see what this says. A novel dopamine and norepinephrine reuptake inhibitor, dasotraline, appears to be an effective treatment for adults with ADHD. So has Adderall been around for like forever? According to results of the placebo-controlled clinical study presented at the American College of Neuropsychopharmacology annual meeting, the agent still in development inhibits presynaptic dopamine and norepinephrine reuptake. It has a half-life suggested of extended steady-state plasma concentration and a therapeutic effect of over 24-hour dosing interval. All right, so a little bit of dopamine, presynaptic blockade, norepinephrine. Almost sounds like Wellbutrin, blah, blah, blah. But okay, obviously a little bit more dopamine, which is what we want. Wellbutrin is not a very effective ADHD treatment. So back to this, I don't get it. We have a few drugs that actually work. If people really do have ADHD, these drugs actually really work. But still, the majority of doctors, when they fish around for giving people medication, even the ones that kind of know what works, still mess around with the first of medications that don't work. Like clonidine, Wellbutrin, modafinil. Oh yeah, the smart drug. Everyone in Silicon Valley is on modafinil. Please. If someone really has ADHD, what you want to do is confirm the diagnosis with a really good clinically positive effect. And the way you do that is by giving the medications that you are most likely to see be effective. And in today's day and age, that's still Adderall. That's why I personally think that that's the first drug that people should try, because you want to know if there's a clinical benefit from being on these drugs. Taking a drug that may or may not work won't help you solidify the diagnosis. And I guess what I am saying is, yeah, it's actually tough to know the diagnosis of ADHD without first giving the medication. But this is something that needs to be worked out.